Good morning, everyone. I'm Gurjeet Chima, and I'll be moderating this panel. Welcome and coming this early today. So this panel of ours today is named New Horizons of Health, AI, and Longevity Amongst the Elite. And we have the pleasure of having three experts in the AI and health and longevity field join us today. So firstly, we have Don So, CEO of Humansa. And also, obviously, we have Danny Xiang, CEO and chairman of Xiang. Danny has actually been leading Xiang in pioneering the postpartum care industry and providing one-of-a-kind services for new moms, actually, for many years now. And last but not least, we also have Alex Chen, CEO and founder of Tigerobo, a company that is known for its cutting-edge AI technologies that streamline health data analysis and sort of like allowing us to rethink how we think about health and how it's also related to AI and how we look at health in the future also. Welcome, gentlemen. So lovely to have you here today. I'm going to jump right in. So, Don, I'm going to start with you first. I think a lot of people have kind of heard of Humansa, and you've sort of said it's not really like a clinic, so you don't really go to it when you're sick only. It's sort of like a wellness center, but a very new version of what a wellness center is. Could you just let us know, for the ones that don't, what is Humansa and how it was founded?
Oh, first of all, thank you, and good morning, everyone. I'll start by saying, Humansa, a quick introduction, our mission is really to help our health consumer to live life to the fullest, to enjoy things that you enjoy to do for as long as possible. It's as simple as that. And by redefining what health actually means. And very clearly, we see the trend where people are fed up with not being sick doesn't mean you're healthy. And that's what we aim to do. A good example of this would be a very popular program that we have. It's called Humansa Future, where we don't take on just normal body check, the blood test, and etc., and then tell you to go home afterward and come back in a year. We look into leading indicators, right? Things like apolipoprotein B, VO2 max, biological age metrics, which is leading indicators predicting how healthy you could be in optimal health. And we also look into things like your lifestyle metrics, right? How well you sleep, how are you emotionally connected to your society, to people, do you have enough, quiet time of yours, and your relationship around, right? All these metrics all come together and comprehend by our multidisciplinary team. People come from different backgrounds, right? Traditional science-based medical background, but increasingly wellness coach, where we call the wellness coach, which in a nutshell, they spend more time with our consumers. And putting all this together into a plan, a blueprint, a strategy where we can help our clients to walk their path and achieve their objective in their life. And these are all being done in places like what you mentioned, very high quality, convenience, location, a lot more like clubs and wellness, community-based setting. So people are not looking for a lot more data. We have a lot of information. We all do these days, right? With Oura Ring, I just saw that it's very popular. And the devices are collecting a lot of information. People are not looking for more data point. They are looking for direction. Somebody to help them, guide them through, and tell them what to do in a measurable way so they can see improvement in their life. And back to our mission, right? Allow them to do and enjoy time with their loved ones, things that they like to do for as long as possible.
Very interesting. So basically, people come to you looking for guidance, right? So how do you provide that kind of guidance, would you say? Is it through AI technologies, or is it through certain reports, or how do you do it?
So we start off with spending the time with our clients, and you mentioned the word AI, and I think that's also where the breakthrough in our industry is, right? What I just described, the Humansa Future Program, for example, the first version, it takes a good 4 or 5 hours for a multidisciplinary team to actually sit down, look at the case, look at all the data, and then have a discussion as to what is the best for the clients, what are the bespoke solutions, factoring in what they're actually trying to do. It's a very tedious amount of time, and unfortunately, half of the time is on administration work as well. This is where some of the AI, I think the breakthrough later on, I think our panelists will share, where the diagnostic, AI are really good at comprehending a lot of, unstructured information and providing I think the breakthrough in diagnostic, right, as a second opinion. Don't get me wrong, I think today we deploy AI technology in some of our centers, and they're really good, and it took a while, but they're really good at providing that second opinion for our key practitioner. So the first part on the diagnostic is really good already. It's beyond what I think we all believe. But the second part, I think, is where the bespoke solution comes. That 5 hours is now 20 minutes. Coming back to, because of the tools and availability on analytics, coming back to a bespoke solution to our client. Many of these, if you've seen it before, it populates the whole thing. And of course, our practitioner now can spend more time with the actual client on the conversation, reviewing the data, challenging the recommendation AI comes out with, right? So these are just a small examples as to what AI can do and how it already transformed what we do, right?
Over to you, Danny. I think a lot of us are very familiar with the concept of postpartum confinement, 坐月子. And from what I see in the current marketplace, St. Bella, I would say, is really at the forefront of providing this. Can you tell us a bit about what St. Bella currently provides? Is it just for new moms only, or are you expanding that horizon also?
Yes, the traditional concept during the month or confinements it's been around for thousands of years, and it's really widely accepted by Asian countries. So what St. Bella has really done in the past is to modernize and elevated this very concept of postpartum recovery concept by creating this remarkable retreat for new mothers and babies, by ensuring the first chapter of baby's life is full with around-the-clock professional care, and as well as anti-aging recovery programs and warm comfort and pampering for the new mothers. So we do this by collaborating with upscale hotels, redefining maternity care, combining with luxury hospitality experience with cutting-edge healthcare expertise. So in the past decades, we've become the trusted choice for families, for newborn families, for modern families in Asia, and also we're setting the gold standard for maternity care in the industry. So now we are the largest brand in Asia. We're covering 25 major cities in the region. We've just expanded into the US by opening stores in Los Angeles and also New York. So really trying to bring this Asian culture and this ancient culture to the world, really, yeah.
In your locations in the US, for example, would you say they're still primarily Chinese clients, or would you say they're more Western clients these days?
This is very interesting questions. So our customer base, I would say 70% is actually Asian customers, so that being Chinese, Taiwan, Chinese, Koreans, Japanese, for example, and then we get 30% of Caucasian customers. Because obviously the marketing to the concept would be slightly different. So instead of explaining to them what confinement center really means, we tell them this is a baby honeymoon. So it's very easy to understand, right? It's just like a wedding honeymoon. So after giving birth, you want to give a retreat as a gift to your wife and also the newborn babies. So that concept really sells well in the US markets.
Interesting, yeah. Baby moon, that's a
Exactly.
concept. I actually, with both my children, I actually hired a confinement lady also. I didn't know about St. Bella then. If I knew, I would definitely have gone to one of yours.
Still not too late to have your third kid.
No. I'm glad my husband's not here today.
You can do it tonight.
Alex, So I understand Tigerobo has made significant strides in the AI and health data analysis. I would love to learn more about the partnerships you've had within this industry, and also the AI solutions that help in sort of personalizing treatment plans for patients also.
Sure. And first of all, thank you for inviting me here. And AI specifically, the cutting edge technology, combined with luxury, I think it's a very meaningful topic. I'm the founder and the CEO of the Tigerbot, and I'm also the chief engineer and the scientist of this field. As I heard Darshan's introduction, I'm very impressed because he has been talking about internet, mobile internet, and today is AI. And at my age, I'm not young, I'm fortunate enough to experience the hype of the internet, the hype of the mobile technology, and now the hype of AI. As Tigerobo, and we produce one of the best LLMs in Asia and over the country. And nowadays, we are focusing on landing these cutting-edge technologies in different fields. And one of the prosperous fields, domain, is the healthcare, such that Danny and I has been collaborating, doing a lot of fun stuff and cutting-edge stuff. Let me give you a couple examples how we can do today. First of all, large language model is very expensive, right? Facebook launched Llama 3.1, and from the white paper you can read the computational hours translate to dollars or Hong Kong dollars is one model, each model 70 billion size of model, almost 100 million Hong Kong dollars or 120 million Hong Kong dollars. So the ROI is not just there yet. And the buzz, the bubble, the hype is really high. People are wishing they can do the disrupting things overnight, but probably AI is not. So we are patiently doing a lot of fun stuff for different industries. One example is we collaborating with Danny. Maybe Danny has some video. We use AI, first of all, as a very smart, very diligent data analysis, 77 times 24. Because Danny's lab or studio, I don't know how to call it, every day has a lot of logs. The nurse, the doctor visits the patients, has a lot of notes taking. And every night, our model analyzes the logs. Give a summary first, and then give alerts if we need to pay attention to the baby or mom. Whether it's a red butt for 3 days or pure milks often. Automatically, and way more diligent, way more alerting than any person or human nurse. That's one thing we can do very good. Second thing is maybe we can show video later or here?
Yes, yeah, okay. After this we'll show a video. I think.
Yeah, we just launched a model to write clinical notes or electronic health records for hospital, right? And our evaluation by human doctor, by real human doctor, in a blinded way shows AI, specifically our model, can write better clinical notes than human nurse for various reasons, right? One of the situation maybe you guys notice, especially in mainland, I'm living in Shanghai, the hospital supply is very short, right? Often you are in the overdraw of the hospital nurse-doctor situation. One night I go to best of the hospital in Pudong area, emergency, right? My wife has some stomach pain, and we got the registration number, and there are 30 more patients ahead of us. This is at 10 o'clock during night. And that's a norm, that's a daily situation in China. And when we visit a hospital, the nurse, the chief hospitalist told me what percentage of a residency doctor daily spending time in writing clinical notes in documentation. A very surprising number, 90%. Instead of primary care to the patients doing clinical research. And now I can tell you, large language model with careful design, with good domain specialization, can write better clinical notes than human beings. That's our first step. The second step is patient consult. We can triage patients. We can answer simple daily questions in terms of sickness or health issues. And tomorrow, we will build real digital doctors. One sentence from this year's Nobel Prize winner and Turing winner, Geoffrey Hinton, the godfather of AI, says it's very plausible, and I believe in. Sooner or later, every one of us will have a family doctor. And we truly believe your own family doctor are better than any human doctor. Why? For any sickness, her or he, this digital doctor, this AI doctor, have seen hundreds of thousands of cases in the past. So I think the day will come, and that's why healthcare is one of the top areas we are landing. But we got to be patient. The hype is too high today maybe, and the capital is too much. But if we do patiently and diligently and responsibly, we will be there. That's what we are doing. Thank you.
Don, I think you have some comments on what Alice was saying. Did you want to add on something to that?
Yeah, I think from a first-hand feel, I agree a lot, right? And first-hand seeing it, I think the great takeaway, I got a lot of questions from my own practitioner, right? Oh, AI is going to completely replace all of us. I think the human role is very important still, and will continue to be. And indeed, one of the biggest challenge in deploying AI into healthcare field is, ultimately, today's system, healthcare, you need a human being who's trained to underwrite that risk. Somebody needs to sign that paper, right? So that I personally don't think is in any time soon, but at the same time, I think the benefit is already tremendous, right? Across what I think the administration, the diagnostic, the personalized plan. And with that, I do want to leave a note on highlighting the human aspect. And I think today we talk about, luxury summit, right? Luxury, I think this is where the community, the emotional, the passion part, is a big part of what luxury is. And indeed, I like to always, in the very beginning, I told people that health, I think many of us have probably heard the word health is wealth. Not a new word, right? But increasingly, I would challenge and I would push the envelope to saying that I think we've seen health actually signals wealth. The world had moved on to fall in love with quiet luxury, like bringing in and transforming from tangible to intangible, from products to more experiential, and that's where, and from individualism to more community basis, right? And we see that across. And at Humansa, we learn our lesson as well. We start with the best product, but we are evolving with what the people want. People want to have the best product is just the basic, right? This is like 101, you need to have that. And I see a lot of those learning from my previous work. Prior to founding Humansa, I spent a decade building wealth management business for Morgan Stanley in Asia, right? A lot of parallels, like draw a lesson we can learn. It's all about, the whole thing is about trust. And trust are built upon by being consistently delivering first-class services in a first-class way. And that's what we try to do. And putting back to the human aspect, right, the community base, and you see that happening already. One of the words, I think, might not be in Asia yet, but you go to the major financial hubs, right? This is like New York, London. One of the biggest phenomena in the longevity wellness space right now is what we call the wellness social club, right? This is a concept where people can, this is a big job city, right? People have alpha people, high intensity, and they're looking for a space, a convenient space in the city to unwind, recharge, restore, and to connect. And we were one of the first in launching in Asia, and we've seen that trend, right? That's how we grew from like 0 to 40 outlets now across in the region.
I think it's all about finding a balance, right? Like, there's a lot of conversation now about how AI is going to affect every single industry, basically. But like, I know, obviously, Danny, you're using a lot of AI tools within St. Bella also, and I understand we have a video today, so I think the audience would love to see that video. If we can play that now, thank you.
Just to add to that, so what we're seeing in the traditional healthcare space is a little bit like Google. If you need anything, you need to raise your hand, you need to pull up the request. But in the future, you should be like TikTok. So we collect a lot of information using AIoT from customers. For example, the nutrition data, and then the newborn baby's data, and we analyze it with AI. And then we provide tailor-made, customized, personalized catering because of the data we collected. So each data links to standard operation procedures. If anything goes wrong, we will directly speak with our nurses, and the AI will help him or help her to analyze what's the issue with this problem and what to do with it. So you provide a guidance to the nurses instantly, intuitively as well, and then they can interact with the AI, why I should be doing this. And then once the feedback was given back to the nurses, and then they will continue to provide services. And then, for example, this issue was resolved under 4 days, and what to do afterward was feed to the nurses automatically. So in any given day, we have about 400 data been collecting feedback to the customers, so everything was run automatically. So this system's been around, we've been doing it for 6 years, and now we will launch as an open source, so everyone else in the world can use it free of charge. So this is something that we've been doing in the past together with Alex's team. And this is called a Healthcare 4.0.
Amazing, yeah, amazing. How do you see that concept along with Tigerobo? How do you see that sort of advancing into the future? Like, what's the aim there also?
Yes, because we've been doing that for a long time, so we are now processing the largest and most comprehensive data for the newborn babies in Asia. And now we are launching this app. It's free of charge, and we're doing it in 10 different languages. So we're launching it, so everyone, kids in Africa, mothers in Africa can download it, and they can ask any questions they have during this maternity, and we'll be able to provide a guidance similar to what we have in St. Bella standard. So they'll get that instantly. So then that enables us to have the most comprehensive data and the knowledge in the world in this space. And then we will be more accurate and more efficient in operating and providing, like Don said, first-class services in a consistent way.
What's the name of the app?
It's called PI, Prime Care Intelligence.
PI, everyone. So.
It's called Pi. Pi means like infinity as well. Yeah.
Alex, a question for you, probably our last question before we do a roundup here. I think as AI continues to advance, what new areas of like health diagnosis or treatment do you think the Tigerobo technology will be focusing on in the future?
Well, I think healthcare, first of all, is probably one of the most high-stake, high-resource area technology aim or dream to land. I think we have 3 stages for this. First is reduce the workload burden of the practitioners, care providers. Second is provide daily, support digitally or AI. Everyone has a app, knows your situation, knows your social history fact, knows your family the best, and provide most personalized medicine advice. And the third, or the diamond on the pyramid, the highest is to cure major diseases, okay, for the humankind, whether it's a cancer or some mental diseases, we can provide the best. Based on across the global, across language barrier, all the evidence we have here, right? We have a video show here, maybe we can provide. This is a real screen record from Shanghai, the major hospitals. And by one click, AI will analyze pages, 100 pages or 200 pages, daily logs or daily clinical notes, and write a very good, better than human clinical notes. That's the first step. As we do this for years, AI can learn many evidence. For example, Danny's app will knows the maternity, newborn baby care, the best in the world. And then for undeveloped country, for West country, they can borrow, they can learn from here. So 3 stage. First is change the situation, supply, demand situation in the healthcare domain with the help of AI. Second, provide daily routine healthcare support or question answering for everyone. Third, help cure major disease for the humankind, whether it's a cancer or mental disease or whatever. And the dream of myself and my company, I believe the whole technology company, is to help provide a better humankind, better well-being. And that's a true luxury. We can spend more time with my loved ones, daughter, and...
Which brings me to, I would love to ask all 3 of you at the Leaders of Luxury Summit today, what does true luxury mean to each of you? Danny?
Well, for me, I think it's time. Because number one, true luxury brands need to go through different cycles and need to be passed down to generations of generations. So you need to be able to survive a long period of time. And second, I think the luxury products or services brings out the best memories and important moment of one's life. When you're using a watch and using jewelry or even using the variety arts, it reminds you the memories that you have. For example, like us, so usually when you ask people what happens after giving baby, the first month is chaotic, it's really painful, it's a bit of a mess. But if you choose Singbella, you will have one of the best times in your life. So I think memories, those important moments actually brings the touch of luxury. So as operator or CEO of this brand, so we don't sell product or services, we sell memories and stories. For me, that's luxury.
Alex, I know you've answered briefly already. Is there anything you would like to add on? What does true luxury mean to you?
Yes, just a short answer is being able to doing things you truly love. Okay, because we not only enjoy life, we have ambitions. We want to achieve something. That's.
And Don, for you?
Personally, I think having the time, the space, the health, resources to pursue a deeply meaningful life for myself, but also for the ones I care for.
I think all of us are very much looking forward to see how all 3 of your companies will develop into the future. Thank you so much for being on this panel today. I hope everyone learned a lot from them, and please feel free to talk to them. They'll be in this room later also. Thank you very much.